Today's stat regimen, the recent COVID vaccine controversy in Florida. Listen in to hear the truth and correct the rumors.
Hi pharmacists and friends, today is January 18th, 2024. Welcome to the regimen where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen in to find out how pharmacists and pharmacy students like me can improve population health, health equity, and patient care through advocacy and education. My name is Cassie Capezza, and I'm a final year pharmacy student at the University of Rhode Island, working with the Rhode Island Department of Health alongside my professor, Dr. Bratberg.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the URI College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by the hosts do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
Today, Dr. Bratberg and I will be talking about a recent topic in the headlines, mRNA COVID-19 vaccine misinformation provided by the Surgeon General of Florida. His claim is that the vaccines are unsafe and should be recalled by the manufacturers. In a research paper referenced by the claim, 24 expired and 3 in-date vials of vaccines were examined. DNA sequences called promoter regions were found in the vials, which the authors deemed concerning. Dr. Paul Offit, an internationally known expert in vaccine science and immunology, explained that DNA fragments in the vaccine don't cause harm because of the several protective mechanisms of our cells that process the DNA fragments into harmless byproducts. Even in the samples where the most DNA fragments were found, the amount was less than half of what would raise any safety concerns to manufacturers, and they must have met safety thresholds before releasing vaccine from their warehouses.
So what is the concern with this public health rumor being announced by figures like the Florida Surgeon General, who many providers look to for information?
Unfortunately, this claim was made by someone in a position of authority. This could lead to less vaccine confidence in providers, pharmacists, and the general public. It's important for all listeners to look at the quantity of facts from trusted resources to be able to assess the safety and efficacy of vaccines. Questioning how medications work is perfectly natural and encouraged, and best answered from your trusted healthcare sources like physicians, nurses, and pharmacists like us who are medication and vaccine specialists.
That sounds good. So what is the solution to correct information that may lead to poor decision-making for patient care?
I think the best way to correct misinformation like this is for healthcare providers to have access to the most correct and up-to-date information. The Center for Disease Control and Prevention, or the CDC, and the Department of Health regularly releases news about vaccines, especially the COVID vaccines. They even provide specific guidelines for who should receive the vaccine and when, also what to expect from the shot in terms of protection and side effects. I'm someone who's worked in community pharmacy for years now, so it's a regular occurrence that my patients hear news and call or come to the pharmacy and ask me directly what the truth is, or not about news like this. This is why it's so important to build a strong rapport with my patients.
Sounds good. So what is the regimen for misinformation in the media and COVID vaccine confidence?
In our role as pharmacists, it's imperative to stay current with COVID vaccine information and be aware of news being released and talked about in the media. This is the best way to be proactive and provide the best care to patients, like listening to their concerns and questions.
Sounds great. If you like this, be sure to follow us at PharmDPubHealth. That's Pharm as in pharmacist, DPubHealth on Instagram, and connect with us on LinkedIn and turn on post notifications so you never miss an episode. Smash that subscribe button now on Spotify, Apple Podcasts, YouTube, Amazon Music, or wherever you listen to podcasts.